We're now on the record. The time is 4:34 p.m. on August 19, 2025. This begins the video conference deposition of Dr. Vanessa Wilson, MD, taken in the matter of Evangelina Golaw Co. versus CSAA Insurance Exchange, filed in the Superior Court of California, County of Alameda, Underinsured Motorist Arbitration. My name is Jocelyn Luna, and I'm your remote videographer today. The court reporter is Eileen Chavez. We're representing Esquire Deposition Solutions. As a courtesy, will everyone who's not speaking please mute your audio, and please remember to unmute your audio when you're ready to speak. Will everyone present please identify themselves and state whom you represent, after which the witness will be sworn in.
My name is Robert Anderson. I represent the respondent, CSAA.
Good afternoon. My name is John Roach. I represent the claimant, Ms. Co.
Cyrus Tabari for Dr. Wilson.
Hi, my name is Eileen Chavez, a California certified court reporter 13389. And this deposition is being held via video conference equipment. The witness and reporter are not in the same room. The witness will be sworn remotely. Doctor, please raise your right hand. Can I see your hand a little bit more? Do you solemnly affirm under penalty of perjury that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
All right. Dr. Wilson, again, my name is Robert Anderson. I'm the attorney that's asked you to appear today for your deposition. I apologize for the inconvenience on a work day. The other parties have been identified as well. There's Mr. Tabari here, who is here on your behalf, and Mr. Roach, who represents Ms. Co. in a claim for bodily injury. Just as a brief beginning here, I want to make sure, do you have any time constraints this evening that we need to be mindful of?
I'm good right now. It's after my last patient.
All right, and I appreciate your being on time. Dr. Wilson, through her attorneys, Evangelina Co. claims that she sustained a mild traumatic brain injury resulting in impaired cognitive functions from a motor vehicle accident that occurred in September of 2023. This includes, according to her attorneys, and among other things, memory issues, inability to focus, loss of independence, loss of enjoyment of social and recreational opportunities, in addition to physical injuries. She also claims that she has an accident-related symptoms that caused her to fall in December of 2024, causing a hip fracture. Ms. Co identified you as her primary care physician who has knowledge of her medical history and her treatment before and after the accident. I've noticed your deposition today to get an understanding of the consequences of the accident and her current condition as you understand that. Do you understand why we're here today?
From what you're telling me, she's blaming the motor vehicular accident as the reason for her symptoms.
Essentially, that's correct. And that's what we have some questions that we'd like to help you clarify us in terms of your involvement with her medical care. First of all, are you aware that Ms. Co is involved in a arbitration proceeding related to this accident?
I'm not.
Okay. Has Ms. Co or any member of her family discussed the arbitration or the litigation with you?
No.
Okay. Have you ever spoken with Mr. Roach or another attorney, Niley Dorrit, about this matter?
No.
Okay. We had obtained via subpoena about 1,700 pages of medical records from Washington Township Medical Foundation. And we'd ask that that be provided to you for the deposition tonight. If you need to access those records, do you have access to them?
To the Washington, South, yes, I can.
All right. First of all, Dr. Wilson, we've been provided with a copy of your CV, which I've marked as Exhibit 1 for attachment to the deposition today. I'm going to see if I can share my screen, and I just got one or two quick questions.
And Dr. Wilson, this is the videographer. If you can maintain on center, not cropping your mouth frame, that would be perfect. Thank you.
All right. Dr. Wilson, can you see what's showing on the screen?
Yes,
All right. Just a little bit of background. As I understand this, you're a board certified physician in internal medicine affiliated with Washington Township Medical Foundation since 2008. Is that correct?
yes,
All right. And the records that were obtained indicate that Ms. Co has been a patient of yours dating at least to 2021. Is that correct?
yes,
All right. Do you have any subspecialties, Dr. Wilson?
no,
All right. Have you ever had any focus training in neurology?
no,
Have you ever had any focus training in geriatric medicine?
no,
All right. And it does appear that you've had some prior experience in emergency room medical treatment. Is that correct?
yes.
All right. And where was that?
In Washington, D.C., Maryland.
All right. And in that capacity, did you have the opportunity to treat and evaluate patients that were involved in traumatic injury?
Yes,
But since 2008, your primary focus has been internal medicine, correct?
correct.
All right, thank you. Now, in preparation for your deposition, were you able to review any of the medical records to refresh your memory?
Yes,
I've marked as exhibit number 2 what I understand to be the first visit of Ms. Co to you after the automobile accident in September 25 of 2023. And I'm going to share my screen again, if I may. And I've taken some excerpts from the medical records. So on September 27th of 2023, Ms. Co, according to the records, presented to you indicating that she'd been involved in a motor vehicle accident. Is that correct?
yes,
And in that note, there is reference to emergency room admission documents. When you saw
yes,
Ms. Co on that date, did you review or have access to the emergency room information?
yes.
Okay, and did you review it when you saw Ms. Co on that date?
The hospital record, the CT scan, yeah, yes,
Okay. And is that why that's included in your visit notes of that day?
yes,
All right. So just to confirm, some highlighted sections indicate that Ms. Co was in a vehicle as a seatbelted passenger when she was in a car driven by her cousin when it was rear-ended. And so that section that we're viewing here is information that was provided from the emergency room.
yes,
All right. So on that date, did you take a history from Ms. Co about the accident?
yes.
And what was that history that she gave you?
So this accident happened September 25, and I saw her September 27 in the office
2 days later.
2 days later.
And
And
what was,
mhm.
I'm sorry, what was the history that she provided?
Well, she informed me that she was in a car accident 2 days before, was seen in the ER. I went to the ER note, and her noticed that, the vital signs, the CT scan report, and what medicine she was given in the ER. And she gave me the history that the day before she had neck pain, and she felt pain in the scalp and dizzy spells. And on the day that I saw her, she was still having dizziness and tinnitus,
Tinnitus being ringing in the
the
ears,
ringing
is
in
that
the
correct?
ears. Yes.
All right. So I'm going to go back to the emergency room records and just confirm some information that you in fact reviewed. And these are excerpts from the emergency room visit on the 25th of September, where Ms. Co complained.
I'm sorry, counsel, you're breaking up. I can't really hear you.
Can you hear me any better?
Now I can hear you.
All right. So according to the emergency room record, she reported a rear end accident, but no loss of consciousness, complained of headaches, the assessment was no altered mental status, no dizziness, and no loss of consciousness. There's a note in a review of systems that she was noted to be positive for headaches, but negative for dizziness and loss of consciousness. And in terms of the neurologic evaluation at the emergency room, noted that she was alert, that there was no sensory deficit, and at some point, no new focal deficits, that her speech was normal and her behavior was normal. And the assessment at the emergency room was a motor vehicle accident with a head injury, a scalp hematoma. And it was noted at that time that the patient, Ms. Co, was able to ambulates without difficulty, was discharged home, and remains neurologically intact throughout. You had an opportunity to review that information?
Yes.
All right. And there was as appropriate, a CT head scan performed at the hospital with an impression of no acute large vessel distribution infarction, intracranial bleed, or focal mass found. But there were mild chronic paraventricular and subcortical hypodensities, which were consistent with small vessel ischemic disease. So did you see the CT scan or just read the report?
Just the report.
All right. And what was your impression of the findings of the CT head scan from the report?
My impression, there's no stroke. I often see this chronic ischemic changes. Those are changes in the end vessels, but it's really very common. So I don't really put too much significance in that, because almost all the CTs that get reported have that finding,
So that
especially
finding,
for. Mhm.
I'm sorry, please finish your statement.
For most of my patients are in the elderly population, so they do have uh, chronic hypertension and other chronic illnesses that can manifest as periventricular white matter changes, which means the blood vessel at the end arteries have some disease, but not to the point of causing uh, physical findings.
So first of all, we would agree that the second finding there, that's not an acute finding. That's a finding that would have been present prior to the accident, correct?
That's right.
And when you talk about the small vessel ischemic disease, those are typical findings in older patients, correct?
That's right.
And typically they don't manifest unless there is a stroke in physical complaints. but they do have some neurologic impact on people as they age. Is that correct?
Yes.
All right. And is it typical that that can result in aging patients with those findings of declining mental acuity, other factors that affect cognition?
Yes, but I don't know that it is a direct effect of having these findings. Other people have cognitive impairment, but not necessarily uh, significant decline.
And in terms of using the word significant, I don't think that's what I was addressing here, only
Oh,
that they
okay.
can contribute to mental impairment in individuals as they age that have this finding. Would you agree with that?
Can you say that again?
The question that I'm asking, and would you agree that those findings may, in aging patients, contribute to declining cognitive function?
Yes, it may.
All right, let's talk about your evaluation on that day. Can you tell us what examination you conducted of Miss Co that day?
Um, well, I did a neurological assessment on her. There's no facial asymmetry. There's no sensory deficits. She was not manifesting any numbness or tingling. Her motor strength is equal on both upper and lower extremities. She did elicit complaint of dizziness when she changed position, rapid changing from sitting to from supine to sitting position. So what I'm saying is there was some dizziness with positional change.
Right. And sharing on the screen, and the P numbers reflect pages in the Washington Medical Foundation for reference purposes, just to identify where the excerpts came from. But what you generally described is in the center of the page, uh, that she was alert and mild distress, dizziness, as you indicated, but she answered questions appropriately.
Yes,
Okay. It seemed to be oriented in terms of the time, place, person.
yes,
Okay. Had good recollection of the incident.
yes,
All right. But there were some physical manifestations of the accident, including the dizziness and the headaches. Is that correct?
that's right.
All right. So you mentioned the neurologic evaluations. And again, tell me, what specific test did you provide to evaluate that?
It's mostly a physical examination.
In other words, it's questioning and getting responses from Ms. Co.
Yes, and
All right.
her physical functioning.
All right. And the gross neurological evaluation, you would have considered then to be within normal limits.
That's right, except for the positional dizziness.
All right. And after the evaluation, you made an encounter diagnosis of cerebral concussion without loss of consciousness. Is that correct?
That's right.
All right. Dizziness and tinnitus,
That's right.
correct?
Yes.
And the plan for Ms. Co at that time was for an MRI. Why did you believe that that was appropriate?
Well, the symptoms that she was having was mostly seemed to be related to a motor vehicular accident. So I wanted to make sure that the best evaluation is through an MRI uh, to confirm, especially with those small vessel ischemic changes, if there's any further details that can be gathered.
And then you also requested a referral to neurology for a consult.
That's right.
And why? What was the basis for that?
Well, it's really making sure that This is all just concussion, that it gets better on its own. Plus, she's a complicated patient in terms of multiple medical history. So it's really trying to make sure we don't miss anything.
All right. And so it would appear that, correct me if I'm wrong, but that clearly there were symptoms that Ms. Co had sustained a concussion in the accident.
That's right.
And that includes the dizziness, the nausea.
I don't think she complained of nausea with me. It's the dizziness and the mostly the dizziness.
There was a mention in one of the records, while it was not mentioned in the emergency room, that she may have had some nausea while in the CAT scan, getting the CAT scan.
Oh yeah, she
So,
said she vomited in the radiology department.
right. So those would be indications of a person who sustained a concussion.
Yeah, and it's actually on my history too. She said she still has nausea but no vomiting.
All right. And in the emergency room records and in your evaluation, there was no evidence of confusion. Is that correct?
That's right.
And there appeared to be no post-traumatic amnesia.
That's right.
Uh, and as we said before, there were no acute findings on the initial examination in your office.
Yes.
All right. So while it's not detailed in your encounter diagnosis, we would agree here that Ms. Co sustained a concussion in the accident.
Yes.
For record keeping, Exhibit 2 was excerpts from the September 27th, 2023 initial visit with Dr. Wilson. And Exhibit 3 is the emergency room excerpt records. All right, let's talk a little bit, Dr. Wilson, about patients who have sustained a concussion in an automobile accident. Based on the records that you reviewed in the emergency room and your evaluation, at the conclusion of your evaluation, what was your prognosis for Ms. Co?
Prognosis. I don't know. It was the first time I saw her for that, and symptoms can be short term. So, but I did have her follow up to follow her symptomatology.
All right, and we will do that. But your experience with individuals who have concussions, what is the typical course of resolution?
I would say, well, I'm not a neurologist and I don't see concussions all the time, but usually they get better within a few days, especially definitely within 2 to 4 days.
So your hope would be that the dizziness, if there's nausea, that gradually that's going to improve, correct?
Yes, that's
All
right.
Now, the referral to a neurologist went to Dr. Kalin. Are you familiar with Dr. Kalin?
Yes,
All right. And have you reviewed the records of Dr. Kalin's evaluations of Ms. Co?
yes.
All right. We're going to bring up on the screen some reports that were prepared by Dr. Kalin. And were the hard copy reports sent to you via the medical records, or how do you receive these?
It was scanned into her chart.
All right. So you would have received it shortly after the visit to Dr. Kalin?
Yes, this is the consult date dated June 5, 2024.
Well, they're in kind of reverse order in the subpoenaed records. So what I'm going to share on the screen is what I understand to be the first evaluation on November 20th of 2023. Do you see
Oh.
that?
Okay.
Am I sharing?
Yes.
All right. And on that date, there's a report back to you thanking you for the referral, gives a history of the incident, and it states on that date that Ms. Co was continuing to have dizziness, bilateral tinnitus, wakes up with a headache, which continues through the day, has some decreased concentration, unable to focus, gets frustrated and irritable, and there are some sleep issues. Do you see that?
Yes.
All right. Now, Dr. Kalin conducted a neurological evaluation, and on that date found Ms. Co to be alert and oriented to time, place, person, but anxious, cranial nerves with no deficit, and a non-focal neurologic examination. All right. Her impression on that time, as I interpret this, and I'd like your opinion, is that essentially, while she was continuing to have complaints neurologically, she seemed to be intact. Is that your reading of this?
Yes.
All right. Now, Dr. Kalin is a neurologist, and is it your practice as a internal medicine doctor to refer to specialists for specialized evaluation?
Yes. If I want more determination, or if I want to make sure that there's really no significant injuries from her symptoms.
All right. And that was the purpose of the referral to Dr. Kalin.
Yes.
All right. And in terms of the neurologic evaluation, were you reassured by that first report in November of 2023?
Yes.
Now, Ms. Co continued to be seen by Dr. Kalin and returned on December 11th of 2023. And on that date, she was still reporting headaches, ringing in the ears, continued difficulty with comprehension and coordination, and had been seen by Dr. Van Tassel, who had evaluated the tinnitus. And the neurologic examination on that date again found her to be alert and oriented ×3, with cognition, memory intact, and a non-focal neurologic examination. Now, on that date, Dr. Kalin recommended that use of gabapentin. What would have been the purpose of gabapentin in terms of the profile that you see in that report?
What's the purpose? I don't use gabapentin for concussion. That would be her. I usually use gabapentin for chronic pain syndromes and like chronic migraines, neurological pain kind of symptom. But I don't know why she chose gabapentin.
In your experience, is that also used for sleep difficulties?
Yes.
All right. Now, moving forward with Dr. Kalin on February 12th of 2024, socially, Ms. Co continued to describe issues such as headaches, irritability, feeling isolated due to inability to drive, taking gabapentin, but because she felt that it made her feel imbalanced when she wakes up in the morning, there were some issues. But Dr. Kalin had noted when asked if Ms. Co felt depressed, she denied it. Do you see that in the report?
Yes.
All right. So again, the neurologic portion of that examination was essentially within normal limits. Correct?
Yes.
All right. And then the last visit that I have, and correct me if you have any additional reports, Dr. Wilson, but was on June 5th of 2024. And the
Mhm.
primary focus of the history given by Ms. Co had to do with emotional issues, irritability, anxiety, difficulty focusing, change in lifestyle, an issue where she may have been disoriented when driving, difficulty sleeping. Those were issues that had to do with anxiety and depression, as you read that. Is that correct?
Yes,
Okay. But again, looking at the neurological examination, Dr. Kalin's report was that it remained essentially normal, correct?
yes, that's right.
Uh, and in this point, she described Ms. Co of having a post-concussion syndrome, which were slowly improving, and headaches that were somewhat stabilized. But that Ms. Co had indicated that she didn't want to take the gabapentin. So in terms of the assessment, are we now a number of months after the accident, about 9, with Dr. Kalin still finding that the neurologic examinations are essentially within normal limits? Is that your understanding and impression?
That's right.
All right. All right, let's talk then about the follow-up visits that you had with Ms. Co following September 27th. And as you've indicated, she, and I don't want to put words in your mouth, but she had a fairly complicated medical situation. Is that
Right.
correct?
That's right.
All right. All right, the next visit that I have, and correct me if I'm wrong, directly with you, Dr. Wilson, is on October 18th of 2023.
Let's see. Yes, October 18, 2023.
Let me get that note. And what did Ms. Co return for on that date?
This one, it was for her follow-up of the concussion and tinnitus and headache. And she also complained of a soft tissue tumor of the left arm.
And there was a note that she was seen by Dr. Bhattacharya.
Yes,
Who is Dr. Bhattacharya?
he's another neurologist.
Did Dr. Bhattacharya, is he with Washington Township?
No,
Have you received any reports from Dr. Bhattacharya of his evaluation or her evaluation of Ms. Co?
yes, he sent us his consult note dated October 11.
All right, I'm going to see if I have that and share the screen again. The
Um, Actually, October 11, 2023.
Well, in your record, it notes that she was seen by Dr. Bhattacharya on that date and reassured she does not need to do an MRI, which was done later, but
Yes, that's
advised
the
that
one I ordered.
tinnitus and dizzy spells will need observation. In the report from Dr. Bhattacharya, was there any neurologic um, testing done or evaluation?
Yes.
And what were the findings? I didn't find that.
Okay. On our, uh, well, it's on our media, which means that's where all the other reports get scanned if it doesn't, if they're not in the system. So it was entered into the chart on January 29, 2024.
And can you tell me what that report says?
Okay, so he did a neurological exam, alert oriented to time, place, and person, not confused, no anosmia, there's no disorientation, head and neck are normal, motor movements, all shoulder movements are full, spine, no tenderness, cranial nerves 2 to 12 are intact, motor function of all the muscle groups, normal tone and strength. The neck flexors and extensors are intact. The reflexes are normal. Coordination, finger to nose test, and rapid alternating movements are normal. Normal sensory function, normal gait, Romberg negative, which is balance. Essentially, no focal neurologic deficits seen on exam.
Right. And that's consistent with Dr. Kalin.
That's right.
And that was entered into your records on one date. On what date, if I need to find that?
January 29, 2024.
All right, thank you.
And sorry to ask, doctor, this is a videographer. We just want to make sure we capture your mouth movement on camera. when
Sorry.
possible.
Okay.
Thank you.
All right. And I apologize, I've gotten a little off track, but the purpose of the visit was a follow-up on October 18th of 2023, correct?
That's right.
All right. And in that evaluation, what were you looking for, Dr. Wilson?
It's mostly to follow up on her symptomatology.
And the symptomatology included what? The tinnitus?
The tinnitus and the dizziness.
And there's a note there that on that date, the dizziness was getting better, correct?
Let's see. Yes, dizziness is better, but she still seems aggravated by rapid head movements.
All right. And what was your recommendation for her for continuing treatment at that point?
Well, I referred her to the ENT, and she's at that point. I said she's being followed by Dr. Bhattacharya, so I assumed that he was following her for the concussion.
Do you have any record of any subsequent visits with Dr. Bhattacharya?
No,
Okay. And the ENT, was that Dr. Van Tassel?
I referred her to Dr. Flavio Oliveira, but he works together with Dr. Van Tassel. I don't recall if it was Dr. Van Tassel that saw her.
All right.
I can look it up.
And the post-exam diagnosis on that date, the encounter diagnosis included tinnitus, benign proximal positional vertigo. How did you reach that conclusion?
It's a clinical diagnosis. It's dizziness brought on by rapid head movements.
Right. And there's a reference in here that we'll talk about also in terms of esotropia. which is it's an impairment of the vision due to misalignment. Is that correct?
That's right. It's
All right.
eye muscle problem.
All right. And is that a condition that can contribute to dizziness and vertigo?
Not necessarily. It can cause double vision.
And do individuals with double vision occasionally experience dizziness or vertigo in your experience?
Sometimes.
Okay. Now, the next visit I have is in November 9th of 2023. Is that correct?
Yes.
And the tinnitus and the dizziness was continuing?
Let's see. So yeah, she feels off balance, but no vertigo. Vertigo is the spinning sensation, but she feels off balance. Her head feels heavy. Yeah, so she still has some symptoms.
All right. And in the record that's showing on the screen now, on that date, there's a referral to Dr. Zonner, Zonner.
Yes.
Who is Dr. Zonner?
He's actually family practice, but he has special interest in concussion.
Did Miss Co see Dr. Zonner?
I don't recall. I
And
don't have
is,
a note from Dr. Zonner.
all right. And did you do any follow-up to see if she had seen Dr. Zonner?
No.
Now, I believe on that date too, that there was a referral to what's called DVOP Rehab Center from you. Do you recall that?
What date is this? June? Oh, what note is this
Let's
date on?
see.
December? November 9, looks like.
That's what I found under November 9th.
Okay, there you go.
There's some discussion of vestibular therapy in the medical records. Was that the referral to, what is DVOP Rehab Center?
Let's see. Actually, I don't know.
Is it
DVOP.
Diablo Valley?
Yeah, for vestibular therapy, I'm assuming. Let me see the referrals. November 2023. Yeah, so that was a referral to through her Hill Physicians Insurance, Diablo Valley OP. I think that's for physical therapy for her tinnitus and dizziness. So something akin to vestibular therapy.
And what is vestibular therapy?
Vestibular therapy is for people who have dizziness related to positional changes. So they are able to do some um, movements that can help desensitize the brain from positional changes. So it can help. It's also another way to treat dizziness.
Did Miss Co fulfill that referral?
I don't think so.
Okay. It was your opinion that that would have benefited her dizziness if she would get that treatment. Is that correct?
Yes.
Did Miss Co ever say why she did not take the referral and get the therapy?
Okay, there were some notes here for prior authorization for vestibular therapy. So these are all just messages trying to get approval for the vestibular therapy. I actually can't see that it was approved or not. The messages was, did we get the approval from the insurance? But I don't see a report that it got approved.
Dr. Wilson, moving on to November 15th, I have a report. The brain MRI was conducted, correct?
Yes.
All right. And what I show is a report of the brain MRI. I don't see the date of this, but do you have that?
Yeah, the brain MRI was November 15, 2023.
All right. And what I believe is on the screen now shows the impression. Did you review the MRI or just the report?
Just the report.
And were there any acute findings there that were of concern to you?
None.
Now, the medical records reflect a number of visits to the foundation where you did not see Miss Co. In December, she was seen for varicose veins. In February of 2024 for dermatitis of the eyelids. In March of 2024, a consult for the thyroid eye disease that we're going to talk about. The next visit that I have in my records with you personally is in April of 2024. Is that correct?
Yes.
And what was the purpose of that visit?
She mentioned, well, it's a follow-up of the dizziness, the tinnitus, follow-up of her anxiety and depression. She had itchy skin in her forehead and left upper eyelid, and her knees felt the instability of her knees.
So what I show on that date you've mentioned, and there's an indication in many of these records that Miss Co came accompanied by her brother.
Yes.
And I believe his name is Joey.
Yes.
All right. And you know, that kind of support is appropriate for anybody, whether it's me or an older sister. Was Joey actively involved in discussing Miss Co's complaints and her problems and what she was doing?
Yes.
He seemed to be actively involved in her care.
They live together.
Following that visit, when was the next visit that you had with Miss Co?
August 16, 2024.
All right. So we went from April to August in between visits by Miss Co to you, correct?
Oh, there's another one in May. In between, she also saw my nurse practitioner. Yeah, she was also seen by the nurse practitioner in April 30, 2024.
And the purpose of that visit was what?
That was mostly her follow-up of her lymphedema. She had history of breast cancer. So right arm lymphedema, and she had a itchy rash in her perianal area.
All right. Were there any neurologic complaints on that date?
Not on that date.
All right. So then to see you, we're going to August 16th of 2024, correct?
Yes. I saw her on May 16, 2024.
Which was an appointment for a rash, but there's mention of depression on that date, correct?
Yes.
Did she discuss with you the issues of depression and why she felt depressed?
Yes. Mostly it's his frustration with her changes in her cognitive function. She says she's the car accident. She's more irritable, depressed, frustrated. Her cognition seemed worse. Um, can't even do her crossword puzzle. Um, and prior to the symptoms, she could drive. Now she couldn't. Her brother is the one helping her all the time.
All right, let's discuss some of those as we go forward, because you've now said that she's concerned about, or you're concerned about cognitive impairment. Is that correct?
Yes.
All right. So in the visits that you've had with Ms. Co to this date, what evaluation have you made of her cognitive functions?
It's actually her description. She can answer simple questions, but she says she has a problem even doing the crossword puzzles.
Okay. So in terms of the visits with her, when you're going from April to August, for example, and you're asking Ms. Co about her experience since that date, was she a good historian?
Yes.
And her memory of events that had been occurring during that time, it seemed to be good.
Yes.
And when she was recalling details about events such as a driving incident or incidents at church, uh, she was clear in explaining those and had good detail.
Yes.
So when we're talking about cognitive functions such as memory issues, what memory issues did you note during those months?
Well, actually, it's not like forgetfulness. Uh, it's her it's her, yeah, she's not as sharp. She feels foggy, but in putting it into quantifiable amounts, I can't answer it.
In terms of her ability to focus on questions that you ask and provide appropriate answers, did she exhibit that she had that ability?
Yes,
And her speech was clear?
that's right.
So were you dependent upon her description of issues with uh, inability to do puzzles, to enjoy recreational activities, to drive? Did you interpret those as being cognitive deficits?
I interpreted them as more like depression. I did evaluation on her doing some questionnaires about anxiety and depression, and she did have significant anxiety and depression.
Well, let's talk about that for a moment. Can you go to the visit where you conducted a couple of measurements of depression, a PHQ-9,
Yes,
it's a question tool, and a GAD-7 measure of anxiety?
yes.
All right. And when was that conducted?
April 16, 2024.
All right. So as I understand the GAD-7 score, it's a numerical representation of anxiety severity based on the patient's responses to 7 questions, correct?
That's right.
And on that date, she scored, what was her score on that test that day?
14.
All right. which falls in the scale of moderate anxiety. Is that your understanding?
That's right.
All right. And the PHQ-9 measure of depression, her score was,
13.
which also falls in the moderate range, correct?
Yes.
All right. Now, the tests measure severity of depression. Those are not a measurement of cognitive function, are they?
No.
They're social indicators, how one feels about their life, for example.
Yes.
All right, we've just got a couple more visits and then I need to move to something else, but let's go to August. So your testing in April of 2024 found moderate anxiety and depression.
Yes.
And then you see her again in August of 2024. What was the
Yes.
purpose of that visit?
Was to follow up the depression. When I saw her in April, I prescribed her some antidepressant, and it's to follow up on how those symptoms were.
And there's a note in the record that she only took it for 3 days. Is that correct?
That's right.
All right. And what would have been the benefit of it's a venlafaxine?
Venlafaxine, yes.
Thank you. How would that have assisted Ms. Co with her depression?
It can help.
Okay. Why did she say that she did not continue it?
It said it made her more shaky and queasy and constipated.
Did you offer her any alternatives?
No, because she said, no, actually, let me check. Dr. Kalon, prior to that, gave her some trazodone, which is also a very, very mild antidepressant. So I didn't, let me see, I don't think I offered another change in medication.
Are you aware if she took the trazodone?
She also didn't take it long. Actually, on that date, I gave her a referral for psychotherapy and psychiatry as well.
Let's talk about that a little bit. Why did you find or feel that it was appropriate for some psychological therapy?
Well, a lot of her symptoms seem related to life stresses, including her accident.
And were
So
there,
it can help.
all right. And there were life stresses in her medical history that were independent of the accident. Is that correct?
Yes,
All right. Now, who did you refer her to for, was this a neuropsych evaluation or a psychiatry evaluation?
psychiatry.
Okay. Did she ever follow up on that?
Um, I don't think so.
Do you know why?
Several reasons. It's very hard to find a mental health provider. So it's not unusual not to be able to see any.
All right. But it was your belief that that would have been a benefit in terms of her depression and anxiety, correct?
That's right.
All right, we're going to try to move a little farther forward here. In March 28th of 2025, you conducted an annual wellness visit with Ms. Co.
Yes.
Right. And on that date, let's see if we can find that record. And these are evaluations that she's entitled to annually, correct?
That's right.
And it's a thorough overall evaluation of health and other issues.
Yes.
Okay. All right, so let's go through on that date how Ms. Co was doing. In terms of cognitive impairment, you determined that she still had some memory impairment.
Yes.
And that was on the basis of her own history or recitation of what she believed her symptoms were.
Yes.
It wasn't supported by any particular testing that you did.
Let's see. No.
Your depression screen indicates she continued to have depression, episodes of crying spells, but declines to take any antidepressants. How did she express to you on that date that she was still depressed?
Well, she has crying spells, mostly feeling down, not suicidal, and similar symptoms as before.
And in the historical information and counseling section, let's see if I can share this. If that's what we're referring to, this is your wellness visit on that date. Is that correct?
That's right.
All right. It notes that patient Ms. Co is no longer driving due to vision difficulties.
Actually, let's see, where is it driving? Oh,
Trying
okay,
to-
there you go. No longer drives due to her vision difficulties. Yeah, she had eye surgery, strabismus surgery, and I think that's the reason for her vision difficulties.
Well, we're going to talk about that a little bit. The strabismus surgery was intended to correct what? The misalignment of the eyes?
And yes,
Okay. But she also had another eye disease, a thyroid eye disease.
yes,
All right. And we'll talk about that in a little bit. Okay. And if we go a little further down under the physical examination, hearing and vision, and are these notes that you made in this visit that day?
yes,
Okay. There's an indication on that date that see Dr. MAANASA in Durham, INDAAREM, for difficulties with her vision due to reoccurrent esotropia, correct?
yes,
And those issues affect her ability to drive.
yes.
Okay. Now, I'm curious about one gross test that you gave, and you gave this before in an annual wellness visit. Let's see if I can bring this up. Do you see what's on the screen?
Yes.
What's the purpose of this test?
It's a very early screening for dementia.
Okay. And she's asked to do what?
To draw a clock.
With the setting the hands to 10 past 11, correct?
Yes.
And did she do it correctly?
Well, the hands are not as clear, but in general, yes.
All right. Now, this test was performed in a 2023 annual wellness exam, and we can go find that if we need. and it was done incorrectly at that point. Is there any significance to you that she failed that test at one point?
Is this clock on 2025 March?
This is the 2025.
Yeah. And you have I don't recall a clock before that. Don't remember it being abnormal.
Belaboring that, let's see if I can. See if I can find that. All right, here's the exam from August 4th of 2023. It appears to me that the short arm would point to the hour and the long arm to the minutes. And it seems to be completed incorrectly on that date. Is that how you read this?
Well, I didn't look at it in terms of the measurement of the hands. I interpreted it as it's not actually not bad because she knows where to put the hands, but I agree with you, the long hand is in the wrong place. But in general, I didn't really think this was clinically significant.
All right. And these records may not be up to date, but can you tell me the most recent time that you've seen Miss Co?
That was the last one, March 28, 2025.
Right, there was, at the outset of this deposition, Doctor, we'd mentioned that one of the concerns is that Miss Co had a fall, I believe, and we'll find it December of 2024, in which she fractured a hip.
Yes.
You saw Miss Co after that fall. I believe it's in January. Do you have that record?
January 22nd. Yes. January 22nd, 2025.
See if I can bring that up. All right, on that date, there were a number of complaints that were voiced to you. The first being follow-up after impacted fracture of the left femur. Correct?
Yes.
There is a recap. See if I can find that she had indicated to you that. How did that fall occur based on your understanding?
She said she was walking from her kitchen to the TV room and she felt dizzy. She tried to hold on to a chair and fell to the floor. And she called her brother, who found her on the floor.
Was there a note in your record that she had told you at one point that she tripped on a chair?
Well, my note here says she tried to hold on to her chair.
See if I can find that. I apologize for scrolling, but you have a lot of pages in your records.
Yep.
All right, on the screen on what I have is page 1589. Under the history, the HPI, I'll highlight this. There's a section, doctor, that says patient fell 1 week ago from standing position, fell on her right side, tripped over a chair. Would you have taken that history from Ms. Co?
Is this December 30, 2024? She
I'm
saw my
sorry,
nurse
I
practitioner.
apologize. Let me try to share this. I apologize. All right, do you see this record?
What's the date? December 17. Oh, yeah. She
All
was
right.
seen by my nurse practitioner, Heital. So, yes, now I see the note. She fell on Wednesday. Yes, 1 week before. She was standing and fell on her right side. According to Heital, she said she tripped over a chair.
So that history was given to your nurse practitioner and not to you.
Not to me.
Below that, there's an indication on the 20th that she phoned to update to recall that she had a dizzy spell, tripped over a chair when she tried to get a hold of it, which may have caused the fall. Do you know why Ms. Co called to give that additional information?
Let's see. So the fall was in December. No, I don't recall that history. No.
Was it unusual for Ms. Co to call in to correct information in a medical record? Or to
Actually,
clarify?
that note was from my nurse practitioner. So I don't know where she got that record from, if it was a phone message. January 20, 2024, or
But was it unusual for Ms. Co to call in and make corrections to her medical records to your best of your knowledge?
usually not. No, it's not common for her.
All right, let's talk about Ms. Co's pre-accident medical history, because you've mentioned that she has a complicated medical history, correct?
That's right.
All right. And one of the allegations, or one of the claims here, is that the fall in December of 2024 was due to dizziness from this accident. You're aware that Ms. Co had a substantial history of falls before this accident. Would you agree with that?
I don't recall her having frequent falls.
Well, I've got marked as exhibit number 6 are some excerpts from the medical records, which I'll share just so that I have this in perspective. Excuse me. All right. Are you able to see what's on the screen, Dr. Wilson?
Yes, this is May 2021.
Right, there was Ms. Co started reporting in the records that we have difficulties with knee stability due to neck pain. And beginning back in May of 2021 in the records is that she was having episodes of knee pain. In the same month that she was having recurrent knee pain causing problems with ambulating. And then Dr. Wilson, going forward to August 25th of 2021 in a wellness examination, Ms. Co marked in the questionnaire that she worried about falling. And in the past year, she had fallen or had a near fall. Do you see that?
Yes.
All right, moving forward to February of 2022, there's an entry in your records of intermittent buckling of knees, which resulted in a fall forward, and she was seeing you because of a bruise on her chin from that fall. And the last occurrence was 4 days ago when she fell on her chin.
Yeah.
That was a history that she gave to you.
Yes.
Okay. And she mentioned about a year prior that she'd had a similar occurrence and didn't recall tripping on anything, but her knees buckled.
Yes.
Correct?
Yes.
So in 2021 and 2022, there was an indication that she'd had at least 1 or 2 falls due to buckling of knees. Correct?
Yeah. Yes.
And then in April of 2022, she had started to use crutches to ambulate because of knee pain. And about 1 month, she'd fallen and landed on her knees. That was an entry in your records in April of 2022. And at that time, you sent her to a consult for an orthopedist, correct?
That's right.
Okay.
She actually was seeing the orthopedic even before then. She even had cortisone injections to both knees in 2022.
So she'd been having difficulty for some years with knee pain and instability, correct?
Right.
So in an ortho consult with Dr. Liu on 4/7/22, which is on the screen now, she reported 2 episodes of falls in the last 2 months, which would have been 2022.
Yeah.
And that because of her anxiety over that, she had resorted to crutches and a wheelchair in avoidance of walking. Correct?
Yes.
And in a vascular surgery department medical record in February of 2023, she reported that she uses a cane for support, is wary of going downstairs for risk of falls, and uses knee braces. Again, an indication that she was having difficulty with stability of walking and knees, correct?
Yes.
Okay. And again, to a PA in the vascular surgery department later in February of 2023, she stated she was using a cane when traveling outside of the house because she was afraid of falling. Correct?
Yes.
And in an evaluation with an orthopedist, Dr. Russell Nord, in April of 2023, a few months before this accident, she talked about pain in her knees, which occasionally makes her fall, and that she has occasional knee instability, which she feels is related to her fear of falling due to intermittent pain. And that's a medical record that you've reviewed about complaints of knee instability and falling in the year of the accident, correct?
The year of 2023.
Yes.
I'm sorry, what's your question again?
So in 2022 and 2023, there are a number of entries with evaluations by providers where Ms. Co reported knee instability that had caused her to fall.
Yes.
Okay. And as recently as August 30th, about a month before this accident, she was seen by Dr. Nord again for advanced bilateral knee DJD and talked about the difficulty of putting full weight on the knee because that gives her limited range of motion and activities feel unstable. And because of that instability, she has a fear of falling due to intermittent pain. correct?
Yes.
All right. Now, my question to you is, with a medical history of knee instability and pain, fear of falling, and a number of falls in 2022 and 2023, do you have any opinion whether or not the fall that occurred in December of 2024 was related to her history of knee instability?
Well, the one that she fell at home and sustained a fracture, based on what she told me, it wasn't related to her knee buckling. Her history said that she either tripped or felt dizzy.
In December of 2024?
20 when she had the fracture, yes.
All right. But you would agree that she'd had history of instability and falls from that knee instability, correct?
Yes.
All right. Thank you. Now, I want to talk about one other issue in her medical history, and that's the vision issues, which I've marked as exhibit number 5. I'd like to review some of the issues of her medical history that relate to vision problems. Sharing the screen, Dr. Wilson, I'm looking at a July 28th, 2022 visit to you when there was a discussion of double vision. I think we've called that esotropia or diplopia.
Diplopia.
All right. So at least at that point, Ms. Coe's developing vision problems that affect her ability to do things. It says here when she turns her eyes sideways, she complains of double vision.
Which
Correct?
date is this office visit?
It's on July 28th of 2022.
And you're not
Okay.
sharing anything, Mr.
Oh, I'm
Anderson.
sorry. My apology. Are we getting it now?
Yes.
All right. So repeating that, doctor, back in 2022, she was experiencing problems with double vision, correct?
Yes,
All right. And that affects what she could do, what she could see, and her satisfaction with her eyesight, correct?
that's right.
And later in 2022, in November, you saw her again for the diplopia or the double vision.
Yes,
And at that time, it seemed to be worsening.
yes,
And there was a mention that in October, she'd lost vision in both eyes, seen at Stanford, who'd ordered an urgent MRI, but did not get that MRI because of claustrophobia. So in November of 2022, she was having worsening eye vision, correct?
yes.
And looking at a visit on November 15th of 2022, you saw Miss Coe because she was saying her vision is getting dim and blurry.
November 15.
Yes. In the highlighted area, it says vision's about the same and she's able to move around the house, but her vision is dim and blurry.
Yes, I see that.
All right. And moving forward, if you can see this in March 8th of 2023, she said she wanted to focus on her thyroid-related eye issues. And is it correct that she was diagnosed with the acronym is TED, or thyroid eye disease?
Yes.
And what are the consequences of thyroid eye disease?
Well, it can cause swelling of the optic nerve. It can cause, well, of course, vision, double vision. There's excessive tearing of the eyes, blurring, double vision. Sometimes it can also cause bulging of the eyes and inflammation of the eye can look irritated and inflamed and teary, and swelling of the tissues around the eye.
And on March 8th of 2023, she reported that when she started driving, she experienced another car going into her lane. So this condition can affect some person's ability to see clearly when they drive, correct?
Yes.
And she was experiencing that in March of 2023, correct?
Yes.
Now, in August of 2023, there was a discussion of eye surgery. Was that to deal with the strabismus, or did that have anything to do with the thyroid eye disease?
Which date is this?
It's August 4th of 2023.
No, the strabismus is different from the thyroid eye disease.
So the thyroid eye disease that was causing the things that you mentioned would not have been corrected with the strabismus surgery.
That's right. It's eye muscle surgery.
And is it your understanding that that condition continues or has progressed into 2024 and 2025?
I think she still has a problem even after the surgery. I don't know that she's still seeing doctor in Durham. Let me see. That would be for the strabismus. The thyroid eye was treated by, I think, radiation. And she was treated with orbital decompression in 2022 at UCSF for the thyroid eye disease.
But the symptoms of that disease were continuing into 2023, correct?
Yes.
Did you have any conversation with Ms. Co that because of her vision problems that it restricted her ability to drive?
Actually, her brother volunteered to inform her she shouldn't drive anymore
And when did that occur?
after the accident.
Okay. Was there a time before the accident that she expressed to you that she was having difficulty driving because of her eye disease?
I don't recall. I don't think
Okay.
so.
Counsel,
Now,
this is the videographer. When there's
Oh, okay. Maybe I'll move my camera so that I
oh
can
no,
see the
sorry,
computer.
doctor.
No, doctor, that's
When
not
there's
it. She is running
Oh.
out of media.
Oh, okay,
Yeah.
okay. All right.
right, I'm running out of media. Are we able to take a break and we can go back on?
yes, but how long will that be?
Very quickly.
Okay.
Okay.
Dr. Wilson, we're going to stop while the videography does something to continue the video.
Oh, okay.
We're going off the record at 6:03 p.m. Pacific time.